Hi, I'm Eduardo Sebescano, founder and leader of Beca Dental Solutions. As we are a responsible company with the aim of improving the public health and quality of life people through a mobile dental service, whose main purpose is health promotion. We carry and range dental and nutrition treatments through units or mobile clinics, working two main care programs: school program aimed at students, business program aimed at workers, hoping to reach the families of both sectors, making the service accessible in cost, time, space. We go directly to the user. We carry out our campaigns of health promotion with the purpose of creating a culture of dental hygiene, prevention and timely treatment of oral disease and nutrition, improving their quality of life. The current situation of the population indicates that 90 out of 10 people in Mexico suffer from cavities or gingivitis, being the main cause of tooth loss. At the same time, 3 out of 10 children and 7 out of 10 adults suffer overweight and obesity. Our commitment to your support is that during the next 6 years, we can reduce these worrying numbers by 70%. At the moment, we start the plan to generate a portfolio of clients waiting for our services, scheduled for the next year as long as the investment is obtained for the mobile infrastructure. One of our most important and interested clients is the trade union of the sector, to carry it to the chain of 4 companies with plans of workers from 500 to 2,500 in the area of the state of Mexico, aiming to cover its state of initial from and evaluate to scale into the surrounding states, having a gradual growth during the following years to be able to cover a significant percentage of the Republic, comply with the promise of reducing the health problem in Mexico by 70%. We have not had income, however we have worked to establish alliances that allow us to enter the market safely and immediately. In addition to having the human resource prepared to start activities, we have a multidisciplinary team of more than 25 people working together to improve public health. The expected income for the range of treatment is approximately 500,000 and 550,000 pesos per month, with a profit of 40%. Operating expenses to cover 1,000 people per month, depending on the demand for treatments, is 300,000 to 350,000 pesos. The main value of the company are fixed assets such as an infrastructure, mobile dental units, with the value of 1 million pesos, dental material with a value of 500,000 pesos speaking accounting. On the other hand, the benefit to public health taking about technological development, coverage of programs, the number of people that benefit from our service, education, creating a culture of healthcare and creating programs that benefit the most affected populations. It should be understood that the mobile unit has a capacity to serve 4 to 6 patients per hour, depending on the treatment, requiring to be able to pay per patient per hour of 280 pesos. In order to obtain an income of 1,000 pesos per month, since 1,000 patients per month as a standard, these numbers reflect an activity of 70%. However, to take into account that the appointment already has prepaid cost in schools, for example, that includes diagnosis and a clinic, or the case of companies that by minimum patient are carried out 2 main treatments as are clinics and receipts. As future plans, it is desired to generate a fund to be able to integrate as a plan the future growth of companies with the acquisition of new materials and infrastructure, hoping to open a free program with the specific criteria later, such as a number of people and specific treatments, mainly preventive, as fluoride applications, phosphate sealants, and fissures and restorative as resins. With that money, we would buy the infrastructure to start the pilot program that we have on hold with the Textile and Workers Union, starting with the project to improve public health. It's important to take into account that we already have the indicated provider that gives us the best opportunity to obtain our main work tool, the mobile dental unit. At the moment of having the mobile unit, we have the human resource, the planning, and the agreement to start our activities as a health service, improving from day one work the lives of many people. I understood that from the moment that I decide to undertake, from now on, it is and will be my way of life. On the other hand, when I decided to study to serve for the benefit of health, I understood what our main purpose and responsibility is to promote health. I believe that an assertive and well-directed health promotion implicitly generates an income. I appreciate the opportunity to participate for a prize that recognizes people who want to change the world.